Welcome to today's Explainer. We're going to dive right into the surprisingly rigorous and honestly totally fascinating scientifically backed world of clinical art therapy. If you've ever found yourself doodling away during a super stressful meeting, or maybe felt this huge wave of calm wash over you while listening to a specific song, well, you've actually already brushed up against the edges of what we're exploring today. We're looking at how the creative process is actively being used in modern medicine as a literally powerful tool for healing.
But first things first, we absolutely have to shatter a really common misconception. When most of us hear the phrase art therapy, we almost immediately picture casual adult coloring books, maybe a simple hobby, or just a fun little afternoon of arts and crafts to pass the time, right? Well, that couldn't be further from the truth. We aren't talking about a recreational activity here, we're talking about a deeply profound clinical intervention.
So, what is it really? The crucial point is that this is a serious, highly regulated mental health profession. It's officially recognized by the American Art Therapy Association. It's this amazing, integrative discipline that engages the mind, the body, and the spirit in ways that are totally distinct from traditional, just talking it out. We're talking about master-level clinicians working in major hospitals, schools, psychiatric facilities, and crisis centers. They use the creative process to reduce distress, build self-esteem, and literally build emotional resilience.
Let's see how this builds upon standard therapies. While standard mental health practices, like marriage and family counseling, share a foundation in psychological development and rely heavily on talk-based assessments, art therapy takes a completely different route. It leverages something called the expressive therapies continuum, using imagery and art making. These therapists deploy distinct art-based assessments to evaluate cognitive and developmental conditions. They actually have to understand the hard science of color, of texture, and media to evaluate how these elements affect different personalities. They are uniquely trained to safely manage those powerful, subconscious emotions that making art can suddenly unlock.
Section 1. Healing mind, body, spirit. How art therapy changes outcomes. Okay, let's dive into the specific clinical impact. Traditional biomedical treatments are, of course, incredibly effective at treating physical sickness, but they often leave these huge emotional gaps. As this brilliant quote perfectly illustrates, rather than just treating the immediate symptoms of a disease, art therapy steps in to address the holistic nature of the whole person. Public health literature shows us exactly why this practice is increasingly used in major hospital settings. It essentially fills those complex emotional and physical gaps left by traditional treatments, especially when dealing with the trauma of severe medical diagnoses. Now, what's really interesting here is how these specific, measured benefits for cancer patients absolutely prove it's a vital coping mechanism, not just a nice distraction. Studies of women with cancer engaging in visual arts, like pottery, watercolor, and collage, found some incredible outcomes. Making art actually helped them focus on positive life experiences instead of just their illness. It let them reclaim their own narrative, maintaining a social identity that was completely separate from being, just a cancer patient. And on a purely physiological level, patients engaging in art therapy actually showed a reduced need for sleep medication and a measurable decrease in physical symptoms and emotional distress. That is huge. Section 2. Indigenous culturally responsive healing, bridging the gap. We also see this holistic approach critically bridging the gap for indigenous communities. Standard Western healthcare often pushes a very biomedical, individualistic model, which can honestly create communication barriers and mistrust, especially for communities dealing with the complex, lasting effects of colonization and intergenerational trauma. But by combining indigenous approaches with art therapy, we move toward community, storytelling, and self-expression. Things like beading and regalia making reinforce cultural identity. Movement-based therapy improves cardiovascular health while processing heavy emotions. By intentionally integrating traditional practices like smudging and storytelling, art therapy creates a safe, culturally responsive space where true healing can actually happen. Section 3. Movement, music, and imagery. The sister therapies. So, art therapy that focuses on visual mediums doesn't operate in a vacuum. It's actually part of a broader, totally fascinating family of mind-body sister therapies. And this brilliantly illustrates the specific biological mechanisms behind them. Take music therapy, for instance. Did you know our muscles, including our heart, naturally synchronize to the beat of music? A trained therapist can use classical music playing at 70 beats per minute to literally slow a patient's racing heart down to a resting state. It's wild. Then there's dance therapy. It isn't just about moving around and having fun. Total body movement triggers a massive release of endorphins, improving respiration and overall well-being. And finally, imagery. There's a common technique called palming, where a patient places their palms over closed eyes to create a warm, dark space. The therapist guides them to visualize a stress color, like red, and intentionally shift it in their mind to a calming color, like blue. It sounds simple, but it has a highly measurable physical and psychological effect on the body. Section 4. The rigorous path forward, becoming a credentialed art therapist. Why does all this matter? Because after seeing the profound impacts of these therapies, when you or a loved one seek this kind of help, you want to know you're in the hands of a highly trained medical professional. To really grasp the rigor here, consider the number 1,000. Before someone can even apply for the National Registered Art Therapist credential, the requirements are staggering. First, they need an approved master's degree, which already packs in 100 hours of practicum and 600 hours of clinical internship. Then, after graduating, they must complete a massive 1,000 hours of direct client contact under the supervision of a credentialed art therapist. This is a grueling process that typically takes at least 4 years of intensive postgraduate clinical experience. And as we can see in this patchwork map, even after all that training, the professional landscape is incredibly complex. Across the U.S., regulations vary wildly depending on exactly where you live. Some states have specific art therapy licensure, like the licensed clinical art therapist in New York or the licensed professional art therapist in Maryland. Other states license them under related categories, like licensed professional counselors, and some just offer title protection or specific state hiring recognition. It is an evolving, highly complex advocacy landscape for these dedicated professionals. So, we've seen the rigorous training, the hard biological mechanisms, and the undeniable holistic benefits for patients facing everything from cancer to generational trauma. I'll leave you with this final thought to consider about the true power of expressive therapies in modern medicine. When we look at the undeniable data, doesn't it completely shift your perspective on what healthcare can look like? I strongly encourage you to look deeper into the clinical arts in your own community. See how the creative process might just be the medicine we didn't know we needed. Thanks for joining me on this explainer, and keep learning.